Nearly 6.5 million Americans are living with Alzheimer's disease. And now, new research out of the pandemic is painting an even more frightening future.
It appears that COVID is increasing the rates of dementia and Alzheimer's, and researchers aren't sure why. Senior health correspondent Monica Robbins explains.
In the age of electronic medical records, instant access to data has never been easier. While patient information is protected, researchers can see medical records. And researchers from Case Western Reserve University analyzed more than 100 million medical records and found a disturbing trend when it comes to COVID and dementia.
6.5 million of those were of people over the age of 65. So we looked at people who had COVID in the first year of the pandemic, and then we followed them for a year. And we asked what proportion of those individuals develop dementia or diagnosed with Alzheimer's disease. And gee, the hazard ratio was 1.69, or 70% increase in the new diagnoses.
The question is why? One reason may point to the massive immune response the body launches to fight COVID. And there's a lot of data indicating viral infections can lead to inflammation, which may cause Alzheimer's disease.
The inflammatory responses are sometimes tremendous, and those compounds do cross the blood-brain barrier, and they could contribute to the Alzheimer's disease. We didn't expect to see quite as much as we did quite as soon as we did.
The research is far from over. What's not known is if COVID-type dementia is permanent.
We're going to continue the study. We're going to continue the study from the patients who got COVID early on. We also want to look at those who got it during the Delta phase, which was a nasty version of COVID, and then the most infectious phase, which was the Omicron phase. So we still have some waiting to do to be able to follow those people for a year.
Studies elsewhere are also showing concerning impacts with COVID and the brain. A study from the University of Oxford showed even mild COVID cases can have cognitive function deficit. They found concerning differences in brain scans from before and after COVID infections, especially among women. Even mild cases showed subtle brain tissue damage and brain shrinkage.
Some people argue that if you don't lose your sense of smell and taste, it hasn't invaded your brain in the same way the alpha has. But I'll tell you, we're still worried about it. We're still worried a great deal.
The National Institute on Aging gave Case a 5-year grant to continue their study.
I think there are going to be very few people who come out the other end of the pandemic who haven't had COVID. And what are we setting ourselves up for 5 and 10 years down the road? That keeps me up. And the other thing that keeps me up is, are there ways that we can blunt this? And what should we be doing to do that?
The data did give some insight to those questions.
Western age people have 30% lower chance to developing Alzheimer's disease.
Preliminary findings seem like common sense. Get vaccinated. Try not to get COVID. And if you do, talk to your doctor about receiving an antiviral treatment like Paxlovid.
We were surprised at how big the effect was. You know, the 70% increase in the new diagnoses of Alzheimer's disease. And we were surprised we saw it in the first year.
Case researchers also found early on that those with dementia were more likely to get more severe COVID. Not only will the future research look at the new variants and how patients are progressing, it will also check the database to see if there's a connection between COVID, Parkinson's disease, and ALS. Monica Robbins, 3 News.